This is Greg Remke. I direct programs for economic thinking. We hold workshops for high school and homeschool debate students on the economics of each year's national debate topics. So the NCFCA League has a policy on federal prison reform, and there's lots of different reforms one could do for federal prisons. I'm going to be making the case here that nutritional reforms, getting federal prisoners better food, better supplements, will significantly improve, will reduce medical costs, reduce violence, and help them improve in the prison. Okay, let's go ahead here. So the argument: normal nutrition for federal prisoners and guards. Poor nutrition following misguided federal dietary guidelines contributes to the impulsive and aggressive behavior in prisons. We have much more on this that I'm going to go to at normal nutrition, and this has to do with the dietary change to reduce fat, which led to increased carbohydrates, usually processed carbohydrates, causing the obesity diabetes epidemic. So federal prisoners are generally unhealthy, obese, diabetic, huge medical expenses, reduced quality of life, and increased aggression. So let's go through some of these claims, some of the research. At economicthinking.org is where we have research materials and posts linked to different articles. We have a section on prison reform, and here are some of the recent articles. And if you click prison reform when you go to Economic Thinking, or click the link below, you'll go to the posts we have, and we'll have a new post covering this, the arguments I'm making here as well. I also do workshops through the school year on the economics of the topic, and these are some of the, this is a draft flyer from the workshops we did during the fall, and we have versions of this online as well. Okay, so the main themes, what do we want out of federal prisons? We want justice, we want reduction in recidivism, we'd like to have job training and improvements so people don't commit more crimes when they get out of prison. We'd like to reduce costs. So I have a number of different articles on, what I think are amazing stories. Prison vouchers, for example, sounds crazy, but would allow for much better prisons and a better experience reducing recidivism. Also letting prisoners work behind bars in a sort of free marketplace like the Maine State Prison did. And so those stories are in previous posts on prison reforms. The theme of prisons, and this is an overview for the general workshops. What are prisons for? Punishment, retribution, rehabilitation, which would reduce recidivism so people get out to society so they're not violent anymore. And then restitution would be the sort of biblical foundation, that is that prisoners having harmed someone should provide restitution. We want justice for the victims as well as justice for people in prison. So more on that in a post. And this is a story about an effective prison entrepreneurship program operating in Texas and Houston, I believe, hugely successful and could be replicated. We have at the federal level prison fellowships, but job training would also help. So again, more articles. And one of the things I focused on in an earlier post was calling for reform of unhealthy prison food. Now this is a little bit complex. There's blogs and there's lots of research on the health damage caused by poor quality of prison food, lack of variety, lack of quality. And of course, the people running prisons at the state and federal level, want to save money. They're not going to serve, steak dinners that are too expensive and one thing and another. But there's another layer of complexity in this, in the dispute over what types of food are healthy. And this is an image from Nina Teicholz, author of The Big Fat Surprise, on how the federal dietary guidelines are hugely influential on the kinds of food students get in public schools with the various meal programs, what people get in hospitals and nursing homes that receive federal funding, what the U.S. military receives, what the food they get as well as in prisons. And the argument is this food is fundamentally unhealthy because it follows the misguided federal dietary guidelines to reduce fat. And it turns out healthy fats are hugely important, and saturated fats hugely important for our health. And boosting carbohydrates and even fruit and vegetables, fruit can have way too much sugar, particularly pineapples and bananas, tropical fruits. So though we're often told eat more fruit and vegetables, that doesn't work for a lot of people. The high carb meals don't work for a lot of people. That's why we have so many in our prisons, particularly in women's prisons, who are way overweight and unhealthy. Cardiovascular disease, diabetes, a whole range of chronic conditions caused by, critics say, poor diet. So here's a post. This is from the Prison Initiative. Food for thought: prison food is a public health problem. So again, poor nutrition is increasing medical costs dramatically. And here's one quick story on that, there's litigation in private prisons as well as public that prisoners that are diabetic aren't getting adequate treatment, aren't getting access to insulin. But what we know from the private sector is that you can reverse metabolic syndrome and high blood glucose levels in a few days by changing your diet. Reduce half the people no longer need insulin after some weeks of dramatically reducing carbs and sugar in their diet. And that's not a deadly difficult, super challenging thing to do. It's just people don't know about it. And so the argument, pushing for a healthy nutrition option at federal prisons would lower costs, reduce violence, and be better for the prisoners. It's controversial, it's debatable. That's why I'm suggesting it for debate. So a discussion here. So again, even the reform people, often some of the reform sites saying federal prison food is bad, and they'll say something like, we all know that more fruit and vegetables is better for your health. Well, we don't all know that. That is for some people, those with healthy metabolic systems, but not for others. And so there's more to look on this. Ideally, we'd give prisoners choices. Ideally, they'd be able to work, they'd be earning income, they'd be developing job skills, and they would choose the food they want, and they would be able to learn about nutrition, what nutrition is best for them. And you do this with scales that measure body fat, as well as, which cost $25, as well as continuous glucose monitors for people with prediabetes and diabetes. This, by the way, is a huge problem for the entire U.S. economy, and as well as Canada and the United Kingdom and the EU. Huge numbers of people are obese. They're the ones getting most sick from the coronavirus and other infectious diseases as well. So more on this topic. Now this is to me a compelling research study. This was done with some 230 adult prisoners at a prison in England. Basically, there was a double-blind study. The doctors nor the prisoners, they didn't know what was in the pills they were taking. Half the pills were full of vitamins and nutrient supplements, fatty acid, that's everyone should take, and the other half were getting a placebo, just a pill. You couldn't taste the difference. And they ran this over a length of time. They found a 26% reduction in violent acts in the prison by the prisoners who were taking the pills that had nutrients. So the argument is that some of the antisocial behavior, the impulsiveness, the violence in the prison is caused by lack of adequate nutrition. And you could argue that, the reason they went in the prison in the first place is poor nutrition led them to be impulsive and violent and aggressive, although that's not part of this study. And there's more on this. Look at the idea of diabetes behind bars. Again, huge number of people in prisons are diabetic. And this article is looking at, hey, they're not getting adequate care, but the general theme I'm presenting here is poor nutrition is the cause of obesity, prediabetes, and diabetes, type 2 diabetes. So this is a quote from this: prison and jail inmates are more likely than the general population to have chronic conditions, infectious diseases, and most inmates are overweight or obese, and more than a quarter have high blood pressure. High blood pressure also caused by insulin resistance, which is poor metabolic health. Your body is unable to handle fluctuating blood glucose levels. And so too much insulin is released. Eventually your cells become insulin resistant. For patients that do, even those that don't face, diabetes or some major disaster, their risk of death is much higher because of suboptimal treatment of diabetes and this poor glycemic control. And they're saying, yeah, the body can't handle the glycemic surges because some foods have a higher glycemic load, or they're more of an impact for blood glucose than insulin. But guess what? If you eat healthy meals like Americans used to, or more did before the 1980s, you'd have bacon and eggs for breakfast. Egg is one of the healthiest foods, and it's fat and it's protein. You don't need carbohydrates to anything like the extent that are part of the American diet. And when you eat healthy fats and protein as part of your diet, you don't get hungry as much. You don't have an urge to snack. The snacking and the cookies and the potato chips, they're creating the cravings that hit people. And that has to do not with poor willpower, it has to do with poor metabolic control. The body is being hit by these surges of glucose and insulin. And again, all the rice, pasta, bread, all these things quickly turn to glucose, to sugar in the body, and we're limited to how much we can handle at one time. And so I have a post on this at Normal Nutrition, mini posts at Normal Nutrition on Substack.com. And so here's just 4 of the posts that aren't directly on prison reform, but they are on improving our metabolic health. The argument is the federal dietary guidelines, this picture from one of the federal, the food plate thing. Here's a family and this like kids eagerly reaching for a tomato and green beans and all these vegetables that are supposed to be so good for us. How's he going to eat that tomato? I don't know. Another book I'd recommend, Eat, Fast, Feast by Jay Richards, looks at the long tradition of fasting as a religious tradition in every religion, as well as feasting. And this turns out to have tremendous metabolic benefits, as Jay Richards himself found out when he learned that the federal dietary guidelines and the, eat lots of little meals and lots of carbs and lots of veggies didn't work for him and made him, turned out to be unhealthy. So again, more articles on these things that I recommend that fit into this sort of presentation on, or this possible case idea on federal prison nutrition reform. Switching gears a little bit, another part of nutrition is getting adequate vitamin D. You get this from some vegetables, from some fish, you get it from the sunlight. Often prisoners aren't getting in the sun enough. This is recent research from Israel, like yesterday's presentation by Dr. John Campbell. That would be March 3rd, I guess. And this is a study from Israel showing that for people who got severe COVID, people who caught COVID and people who had severe cases or died from it, almost most of them were way low on their vitamin D levels. 87% had less than 2 nanograms, which is considered way deficient. 34% of people who had mild or moderate disease had way too little vitamin D. So if you have low vitamin D, you're 14 times more likely to have severe or chronic disease with COVID and with other infectious diseases. Vitamin D turns out to be hugely important for our immune system. So, for anyone listening, have your vitamin D checked. Make sure you're taking enough vitamin Z. For debaters, you want to research this because there's, one, Tim Spector, author of The Diet Myths, argued that, well, yeah, they're low on vitamin D because they're sick. Because being sick, chews up your vitamin D. But this study argues that no, the people that got severely sick had been low on vitamin D for months or years in the past from past testing. Make sure you get enough vitamin D. For kids in sunny area where you're outside and getting sun, that's great. But for people in prison, for people that are working at day jobs inside, often you don't get enough sun. So that's the general story. What about prisoners? This applies to the danger of getting COVID in the prisons, in the U.S. prison population, the federal prisons. And so you want to look at, what's the current policy on vitamin D supplementation? Dr. Fauci, who is, interviewed so much on television, somebody asked him about vitamin D in the U.S. The federal dietary guidelines, or the federal minimum daily requirements argue for like 600 IU supplementation. In England, I think it's 400. Fauci said he's taken 3,000 a day. And he's not he's a small sized person. So if you're 6 feet tall and you're in a prison, how much vitamin D do you need to have adequate levels of vitamin D to reduce the chance of infectious diseases and poor health? And then so here's a study on vitamin D status in prison inmates. And what it found is, and of course, vitamin D from the sun, if you've got black skin, it's harder for the vitamin D to get through the melanin in your skin. So some 50% of prisoners in maximum security prisons are deficient on vitamin D, 30% of whites, 14% of Asian Americans. It changes some when you go to minimum security versus maximum security. But the US, we've got the highest prison population per capita of any country in the world, and huge number of people in our federal prisons are low on vitamin D. So a nutrient supplement that is for healthy minerals and nutrients and also vitamin D would reduce serious infections, make people healthier, reduce medical costs in our prisons as well as the general population. So this, again, poor vitamin D studies in the US and in UK, scientific literature on this, and I have a link to this particular study, and of course there's others. There's whole podcasts on that. So generally relevant too, are you or your parents feeling anxious, impulsive, aggressive, violent? Is that just because you're a bad person and not disciplined? Well, maybe, but as likely it's because you're getting poor nutrition. And so the argument is there's a connection between these impulsiveness and aggression and the violence that gets people into prison in the first place. Having the wrong meals is a problem. So the big push toward low-fat diets, the brain is almost all fat. It needs fat. If you're cutting way down in fat in your body, that's not going to reduce your weight necessarily. Obesity is generally caused by too much carbohydrates, as books from hundreds of years ago to today have documented. If you're overweight, it's generally not for everybody, but like for 80% of people that are way overweight, it's that your body is allergic to carbohydrates or has trouble processing carbohydrates. Carbohydrates, particularly processed carbohydrates, boost your blood glucose level, insulin levels, and cause these other things, and upset your mental health. Your brain gets fed by the same bloodstream that sends nutrients to your muscles. So this is, I believe, Dr. Georgia Ede giving a presentation on eating low carbohydrates. Whole food diet appears to be a powerful strategy, she says, for improving a number of health conditions, including mental health. And some of the anxiety, she talks about a epidemic of anxiety and mental health problems at America's universities, and she sees that as being dietary in origin. So we switch gears, and then she has articles on this, 8 reasons to try low carb for mental health. Keto, the keto diet you often hear is ketones. Ketones are a fuel that your brain uses that in many ways are better for people that have insulin resistance of a kind in their brain, that glucose is a problem for them. So moving from here to federal prisons, the percent of people in federal prisons not receiving mental health care is 66%. The people, recent violent shootings, the wrongdoers often have mental health problems, and of course the guards or the policemen who do these violent acts that launch so many riots, they often have mental health problems. I'd look at, are they getting adequate nutrition to their brains? Are they irritable? What you don't want is policemen feeling anxious, impulsive, aggressive, and violent. They already have enough challenges trying to deal with crime and family disputes in America's inner cities and elsewhere, but you don't want them to have metabolic problems on top of that. You don't want policemen to be overweight. The joke about too many donuts or whatever. And that being overweight, diabetic, pre-diabetic is often linked to the kinds of food they eat, not a lack of willpower, not just not caring about fitness. Many do a huge amount of workouts, but they still can't lose weight. You can't outrun a bad diet. And again, we have more posts on this, both on economic thinking. I've got a whole nutrition section there as well as normal nutrition. So now the article I cite here on the Prison Institute, these sites are often, funded by foundations, and they're very big on reducing saturated fat, reducing meat, eating more veggies, more fruit. So there is a nutritional debate going on. A lot of discussion on the microbiome, on getting a healthy microbiome. So that means eating vegetables or eating fermented foods, sauerkraut, kefir, kimchi, and other things like that. I'm not sure how that's going to work in a federal prison. You roll out the new kimchi program and have everybody start eating that. But if people are educated, if they have a chance to learn about nutrition in a prison, let the prisoners choose among food options. Government's job is to prevent them from causing harm to other people. So the jury and court has sent them in prison. The prison system's supposed to keep them in there, keep them safe. But keep them provided with healthy food. Healthy nutrition should also be part of that for our own benefit, right? To make them safer in the prison and safer when they get out.